The South African Medical Association is threatening to take legal action against the Gauteng Health Department. The association says more than 50 Gauteng doctors have not been paid their full salaries for the month of January. Let's get more details now on this. We're joined by Dr. Akhtar Hussain, who speaks for SAMA and is the chairperson of the Employed Doctors Forum. Dr. Hussain, thank you very much for your time. Explain to us what exactly is going on here.
Thank you so much for having me for Channel 405 and Newzroom Afrika. What you mentioned just now is very true. More than 50 doctors, those are the medical interns, newly qualified, joined 1st of January. Community health services doctors, they didn't get the payment for their salary for the month of January at the end of 30th or 31st. And that's really caused a lot of stress, those doctors who join the services in the front line not getting paid. The matter is not the new for Gauteng Department of Health. This is becoming a chronic problem. We have warned them last year and previous year. They have done the same mismanagement and there's no accountability in that department. They are blaming now other stakeholders like treasury and funding issue. And then they're also saying that they haven't got enough paper to enroll them for the payment. The question is, if somebody is working in a medical fraternity as a doctor from Health Professional Council registration, how you allow, if they have a shortage of documents, to be a practicing doctor? So this is totally wrong, and they have mismanaged whole service deliveries and payments of the doctors. Now they're looking for excuses because end of December and January they're supposed to finalize everything first 2 weeks.
Yeah.
Now they are telling they're going to pay soon, but we have threatened them. They said by 24th of February all the unpaid intern will be paid.
All right. So you're clear in your response there, Doctor. Just a few statements that you've made that this is now becoming a perennial issue, and to make matters worse, there isn't a firm date as to when these doctors are going to get their monies. What then is the next step from the doctors themselves? Is there a threat of withholding service?
Because we are committed professional doctors, we look for our service deliveries for the patient, and we start strike or threaten to close down the hospital or service delivery. At the end, not the Department of Health, Gauteng, or the administrator or human resource or the DG will suffer. The patient will suffer most. And you know, our patients are critically ill in ICU, casualty department, maternity. We provide 24-hour service. If they don't act fast, we need to have another way of negotiating and make sure all the doctors get paid as soon as possible. But 24th is too late.
All right. And so the next course of action, perhaps, before I let you go, Dr. Hussain, what is the next step in trying to get this matter resolved?
This matter needs to be resolved for once and ever. You know, it's not a first time. This is becoming a chronic problem of National Department of Health. We will ask for accountability. Those who have mismanaged this program, and those are causing trouble for our doctors and paying for the salary not paid. So what we will do, we will wait for the response. They did acknowledge our letters of demand, and now we need to sit down and we need to formalize for next year and coming year. This must not happen, and we also demand those people are doing the wrong thing, or incompetent management or incompetent HR who fail to roll them in the computer. You know, it's a digital era. You cannot leave this thing for months and weeks to do this. You can do it in 5 minutes in computer. And now the blame is they're also saying there were so many doctors we appoint in January. It's not so many. It's a few hundred. It's not one hospital. There are many hospitals in Gauteng. Each hospital maybe 20, 30 or 40 doctors. So they cannot blame that the workload was very high. The problem is department need to look for those incompetent accountant, incompetent human resource manager, clinical medical managers. They need to be answerable. They need to be taken action on them. And we are going to demand for that. Thank you.
All right. That's Dr. Akhtar Hussain. He is with the South African Medical Association. Apologies there for the constant interference in the sound. Clearly, Dr. Hussain is someone very busy, fielding calls at the moment, you would imagine.